The launch of critical illness cover couldn't have come to a better place than now, when we see so many Kenyans suffering from chronic illnesses. Joining me is Justin Kosgey. Thank you very much for joining me this afternoon. Now, if we can discuss, what is in your cover in the chronic illness?
The chronic illness cover is designed to pay a lump sum at the first diagnosis of any of the critical illness, of the chronic illnesses that we have listed in our product. And we think this will go a long way in helping families deal with the huge burden of financial constraint that these conditions bring into families. Yeah.
Is it safe for me to say it's a saving grace for Kenyans who are suffering from chronic illnesses, let's say diabetes? Does it cover all that?
If you're already diagnosed, you can't take the cover. You only take the cover now so that it takes care of any of those conditions when they come around. And I think that's very important in bringing in issues to do with planning yourself, planning your resources towards financial stability.
Give me a synopsis of how one can subscribe to the cover, and then what is the premium? What premium? How much does someone have to pay?
As an example, if you are 30 years old, you can pay 2,500 shillings every month, and you will be paid 10 million shillings in case you're diagnosed with any of the chronic illnesses. The process is simple. You walk into any of our branches, or you talk to any of our financial advisors or our agents or our brokers, or you come to our offices, our head office on Upper, and you fill a form, and we're able to review and give you the cover. It's as simple as that.
I've seen so many Kenyans fly out of the country to get treatment. Treatment here is so expensive. A Kenyan who's probably trying to fly out, how will it cover that?
The biggest difference between critical illness cover and the standard normal medical insurance cover is that critical illness cover, once you're diagnosed with any of those conditions, it pays you a lump sum and you decide where you want to be treated. So if the condition requires that you fly out of the country to get treatment, you'll have the lump sum amount in your account, and you can decide to go to a better facility or a place that you've been advised by a doctor that you'll get better care. And that is why we think for this cover, it removes those constraints. It gives you the freedom to choose where you want to get your cover. The standard medical cover that we have, and it's everywhere, it's very good, but it pays you only when you're in hospital.
And how does this cover the low-income earners? How will they benefit from this cover?
This is actually a very fair product because it ranges from 1 million shillings cover options to 15 million shillings, and it's pretty affordable. I've just said 2,500 shillings for 10 million shillings if you're 30 years old. So it's way cheaper when you take the 1 million shillings option. And remember, with this 1 million, you can get the best care locally. Okay,
since its launch, how many people have you been able to absorb?
Approximately 2,000 people have enrolled. This is a good thing. But then, if you look at if you look at the fact that we have over 150,000 people in our health, there's still a long way to go to ensure that more and more people enroll.
Compared to NHIF, what will you offer that probably stands out from it?
NHIF and any other health insurance cover restricts you to hospitals and facilities that you can utilize. And it's a good thing that NHIF has expanded the cover for critical illnesses. However, this expansion is restricted to only treating you when you're in a facility. For this benefit, you get it and you use it to even get more help. You can go to a facility of your choice and you determine what you want to utilize. So in as much as, for example, health insurance maybe give you a 500,000 shillings, this one gives you an additional cushion that comes in as immediate cash for you to utilize in your health.
Do you think this product is going to boost insurance penetration?
Younger and younger people even being more and more being diagnosed with critical illnesses, and we think this will encourage people to save or to put in some money or some plans in place to ensure that they protect their financial freedom, they protect their health, and they protect their families.
And we've seen the government launching universal health care. So are you going to incorporate this?
Given that we have other products that we have designed which are well priced, affordable, and already covering more than almost 200,000 people in Kenya. We think that we are supporting the universal healthcare coverage, and bringing this cover on board ensures that we're increasing the scope of cover and options that the citizens have, not just relying purely on what the government is able to provide.
For a person to subscribe to this cover, how long, what's the grace period you're giving someone to actually, so that the treatment can immediately start?
It's just 1 month. So any diagnosis that diagnosed from 1 month when you're taking a cover, first time diagnosis, that is covered.
And probably if you can tell me future prospects?
We cover organized groups, we cover NGOs, we cover, generally cover groups. So I think the next option that we have is to get as much learnings and feedback from our customers from this initiative, so that we find areas in which we can improve on.
Okay. Thank you very much, Justin Kosgey, for that fruitful discussion. Now, for Kenyans out there who have been suffering from chronic illness, that is a takeaway from you. You can actually subscribe to critical chronic illness cover that will be able to cover you in a lifetime.